Good evening. Welcome to the town hall meeting tonight. We have several important subjects to cover. Those are healthcare, housing, utilities, and local government. We do have a couple of panel discussions lined up. We want to start with an opportunity for people who would like to come up and speak. We're going to allow 3 minutes per person, and like Wolf mentioned, if you'll save your responses to the end. So these are just either thoughts or suggestions of a particular topic or questions that maybe some of our panelists might want to answer during the course of the evening. You're welcome to come up to the microphone, state your name. As we said, you don't need to state whether you're inside the city limits or not. All are welcome to attend. So we'll start with that quick sound off and just take this opportunity to come on up and take 3 minutes.
I can start. I'm Leighton Randner. I'm a candidate for office here. I'm for District 5 representative. I've been a resident here for about 7-8 years, somewhere in that window. Haven't been counting the days, but yeah, I decided to run pretty at the tail end of the deadline there, and I made the decision primarily just because I didn't think the representative that we have has been sort of representing this area and sort of fishing industries, free market values, those kind of things, which I've sort of taken up as my things in the campaign that I've been talking about the most out of everything. But yeah, I'll just keep it short.
Okay.
Thank you.
Thank you.
My name is John Howard. I'm running for City Council. I just want to say thanks to everybody for showing up tonight. I missed the last meet and greet due to a family trip I was doing, but I'm glad everybody showed up tonight and discuss these topics that are important to everybody as they are me.
Yay, Bruce.
Okay.
This dude can talk for
3 minutes.
Can you handle that? Bruce Jaffa, Moose Pass. I enjoy participating in community affairs. It's good to see a number of people come out and participate in things that affect our lives and our government. I don't see enough people come to council meetings. I'm on the PAC app. Advisory ad hoc group in Moose Pass, Advisory Planning Commission. It's an opportunity for citizens to come and talk to people who are part of their government. You need to seize on that opportunity. It's a cherished and fought for opportunity that we have in America. It's not a casual thing. And our government works best if the participants tell their elected people what they want. I just recently saw a documentary on Benjamin Franklin, who was, like many people, somewhat blemished, somewhat a genius, a mixed bag. But he said that our form of government, our democracy, that he helped draft and create, only worked if the common people participate. It was not a system that should be handed off to the elite to operate. So that means that you and I and everybody else needs to come and speak our mind. You don't have to be right. I'm like a broken clock. I am right twice a day, but there's lots of times where I will listen to people and learn, and that's what I'm hoping to do tonight.
For those who just may have walked in, we're just taking a couple minutes. If you'd like to come up and speak about any of the topics that we're discussing tonight, or just anything in general that has to do with the greater Seward area, you're welcome to do so. We'll allow just another minute or so for those who want to be brave and step up to the mic.
Hey guys, I'm Dr. Galtham, who a lot of you might know me. I just want to bring up as an aside, because I'm leaving soon, so I want to make sure these issues are addressed in the future, so that we're not reinventing the wheel as far as some problems that I think should be addressed. One is that I think paid 24-hour paid EMT or paramedic would be a really big advantage. I know that's something that people are working on right now, so I just want to put that out there. Second thing is I feel like a greenhouse of some kind would be really, really helpful because we have issue with getting fresh food to a lot of our seniors and people who are in poverty. It's very hard to get fresh food, and I feel like that directly impacts a lot of healthcare issues. And also a way of like maybe expanding what's it called, I keep wanting to say food clinic, what's the word? Food bank, yeah. So a few things there. Home health might be another good thing. So I just want to throw these ideas out there for the future for discussion, because I'm leaving soon and I don't want future people to like feel the need to reinvent the wheel, but it doesn't have to be discussed today. Thank you.
These are fast speakers.
Not to cut anybody off yet. While we're waiting to see if anybody else would like to step up and voice their opinion, I did want to share just a few excerpts from a letter that Becky handed me, and this was written by Beverly Dunham, Dot Barterson, and Carol Jaffa, and it's just an open letter to the Seward Community Health Clinic board members, executive director, and staff, and sort of the general public about some of the things that are happening in Seward when it comes to healthcare. And again, I'm just going to read a few excerpts. It's a very long 2-page letter. If you'd like a copy of it, I'm sure Becky would be happy to share this with you. North Star Health Clinic, operating in Seward since 1987, will be replaced in 2025 by the new Regional Healthcare Center, serving patients here on the peninsula and neighboring communities. It will offer a full spectrum of outpatient services. Meanwhile, the Seward Community Health Center wants to increase the size of its facility and, like the new clinic, offer greater variety of health services, more examination rooms, and the ability to bring more visiting medical specialists to our community. The new clinic is expected to be completed in 2027. Ongoing loss of medical staff, some of whom may be hired by the new regional health center, does not bode well for SCHC. Finding doctors for small Alaska clinics has always been difficult. They go on to say that the SCHC board has appropriately stayed silent about personnel issues. However, the public must urge them to take steps to improve the clinic's ability to find and keep excellent medical providers. They say, we are simply 3 old women who still care deeply about our community, our home, for a combined period of 182 good years. We deeply respect the providers who have left the clinic and those who remain. Our objective is to assure a healthy atmosphere so the clinic can continue to serve us, the citizens. We request a close look by the board as to why there is so much staff turnover and take steps to cure any problems. Just wanted to share a few excerpts again if you're interested in reading that letter.
Thank you. Becky Dunn, I am reading a text I just received from somebody, Angela Schwartzfigner. Oh my gosh, I butchered that. At Pacific Park, she is the manager of Pacific Park, and she says that they have 1 2-bedroom and 1 3-bedroom available, and she feels that the low-income housing in the area, that it would be easier to get out or benefit the public somehow if the threshold of the income that people have to get in, you can't make more than a certain amount, and that threshold is not being raised as high as the cost of living and as high as the cost of income. So this next part is added by me. So it also is another rolling up thing, as it there's a lot of people intentionally underemployed, and that'd be a terrible place to be in. You could lose your housing for you and your kids if you work a full-time job, or sometimes even a part-time job. So I don't know how that needs to be raised or what we could do on that, but just a suggestion for problem shooting.
So we were hoping to have a couple of people come up. We were missing a few folks that that were invited to attend to speak on healthcare. I know we have several people in the audience here that are part of our healthcare system here, healthcare community, so to speak. If we have some volunteers, it's a completely volunteer panel to come up and just maybe field some questions from the audience or take another minute to speak about healthcare, that'd be great. We have any volunteers? Anybody willing to come up and field some questions?
Yes. Thank you. There's the first. Come on.
I will field any questions.
Okay, yeah, I'll get the chair.
We can bring some chairs up, actually.
Oh.
We'll put you on the official.
Oh, okay.
We're putting you up there. That's
Oh,
where
great.
people get to ask you questions.
Hot seat.
Okay,
You're right.
now I'm getting nervous.
Please identify yourself so you can position. Oh, we're getting a full panel now.
I just noticed we forgot
We
the
didn't
chairs.
have any chairs.
But you think anybody was gonna come?
You weren't sure.
I don't know if you guys can hear, but my heart is like pounding.
Pass it down there.
Very good. Let's get one more. All right. I will sit on a stool.
Okay, we're gonna do this. Somebody's gonna get the comfy chair.
I'll do it so I can know.
You can.
I will be your support.
And then, if you two get along, you can share a microphone. If you don't, we'll separate
We
you.
spent a lot of time together, so.
Okay.
I think we can get along.
Our panelists can just take a second to introduce themselves, and we'll just go from our left to right.
My name's Lindsay Dunaway. I'm clinic manager. I'm also an LPN, and I'm at Seward Community Health Center.
I'm Melody Story. I'm the director of nurses at Providence Seward Medical Center.
I'm Harsha Gautam, I'm internal medicine physician at Seward Community Health Center.
And I'm Craig Ambrosiani. I'm Craig Ambrosiani. You gave me the bump one.
No, you're just turned down.
That was not intentional, Craig.
How about now?
You're soft-spoken, so you're.
Oh.
It's good.
No, I'm Craig Ambrosiani. I'm director of Seward Community Health Center. The one thing I wanted to bring up that I hadn't heard yet was, and I'd like some feedback on, is transportation. I really think that growing our availability of transportation in our community would improve the health of the people in our community by giving people better access to go to the grocery store, go to the food bank, to socialize, to go to church, do those things that keep people healthy.
You know, Craig, I totally agree. One of the problems that we have out of the emergency department is actually getting rides for people to get home. It's huge for us. The taxi services, they're hard to get a hold of. We can't get rides for people to go home. So yeah, that's a real problem.
You know what I heard from Red Eye Rides is that, part of the reason we have so few taxi companies in this town is because the liability insurance to pick up somebody at their personal residence is insane compared to the insurance that Red Eye Rides pays for picking up in local areas. And that is a huge, I mean, we've lost one taxi company for sure.
There's 2 or 3 actually that we're doing.
Yeah, and I know we at the health center, we provide tokens for some of our, we provide taxi rides to and from your appointment. But every year, our number of cabs gets smaller and smaller, and that, the transportation is huge for this town.
It is.
And also maintaining of sidewalks and things like that over the winter time, so that,
They don't.
I know,
Yeah.
I think what a lot of us want to hear about though is human resources and retention of good staff. We've been losing a lot of good people over the years, and we want to know if it's going to end and that there's going to be a welcoming, pleasant atmosphere for the healthcare professionals.
I can start with that. yes, we are changing some things up at the Community Health Center. We've added human resource staff and made that more of a priority to work with our staff so that we show better appreciation, that we hear them before things get too far gone, and that we have better communication between professionals. We've also hired a contracted medical director to work closer with the clinical staff rather than having non-clinical staff working closely with the clinical staff. So we're trying to bridge some of the things we've found that didn't go quite right in the last few years. And one of our issues is funding. We don't have a lot of funding. We're pretty much a break-even operation. As we're able to get more funding, we can afford more staff and do more things for our staff.
I will fully admit as a clinic manager that I don't have the most management experience. I did have supervisory experience. I feel like I do well with my staff, and you know, for me, I manage the support staff, which is MA's nurses, the day-to-day around the clinic. I know I can do better, and I am personally working on that. We're always trying to do the best we can for our community and our people, and I do feel that my heart is there and I can do better. So I will say that.
We all love you, then.
Lindsay's pretty amazing. She works like 3 jobs at the same time, so.
I can speak for you too, Lindsay. I love working with you. I will say for Providence that one thing that I've noticed the last couple of years is that we have now started to bring in new people from the lower 48, relocate people and give them housing for at least the first 2 months, which is something definitely wasn't happening when I came up 11 years ago. So I think that's a bonus. That is a big problem here in Seward though, it's just the lack of housing. Even for us to be able to have, can you not hear me?
No, I just got.
Oh, okay. It's like usually I talk pretty loud.
Louder.
I can be pretty loud. Can you guys hear me now? So, some of the problem is there's just such a lack of housing here in Seward. That's something we need to really work on. But as Providence, we're working on retaining the people that we have by, you know, giving them raises and doing more things for them. We're offering more education, those kind of things. We're trying to listen, we're trying to do better. And again, like Lindsay, I'm a new manager, only been here a year, but we're really working hard to start new programs and to do better for the community. We started a SART program. I think that's great. And so we're doing great things, and we're all working together as a team. So anything that you can think of that we could do better, please let us know.
And I will say we really do appreciate the collaboration between Providence and ourselves, and other, like Albie and I communicate back and forth between North Star. There's good communication in this community, so.
And Glacier.
And Glacier,
Yeah.
that's true. Yes, Brent has loaned me IV materials, yeah. So yes, Brent is amazing too.
Brent is watching on YouTube, so I hope you heard that. I let him know last minute. I completely forgot about him, and I really respect and love the man, and I can't believe I did that.
Right.
Yes,
I also want to add on that Brent is also doing forensic exams.
Yep.
So that's great. So he's a big part of the program too.
Yeah, Bruce.
My dad was a doctor in a community in Ohio that practiced through 3 generations of families. He's OBGYN. Medicine was not a business when he started. He hardly would recognize where we'd come to and didn't, even in his, I think, 60th year of practice, where the age of specialty and medical malpractice issues changed the world. But I'm very curious when you speak about impact and costs, and I don't doubt that everybody's doing the best they can with available funds available. But Providence wants to increase their investment in Seward, At the same time, the health community, the health clinic appears to be struggling with economics. How's that happen?
Basically in healthcare, we're in two different businesses. The nursing home for Providence does very well financially. The ER, lab, and x-ray is more of a break-even operation. For us, we're outpatient. We just see patients for visits, and our revenue comes from the number of visits we see times what we get paid. Our costs through the COVID years, our cost for our staff went up well over 20%. But our payments from insurance companies didn't go up a nickel. So we're coming up with new ideas, new ways to improve our income, because we have not recovered from those inflationary increases from a couple years ago. But we are on the mend. We are coming up with ways. We are renegotiating rates with Medicare and Medicaid. So we're stable. We're just not gaining a lot of ground, but I see in the future where we do have some opportunities to gain some more ground.
Number one is staff retention, because a new physician can't really see like a lot of patients in the beginning. It takes time for them to build their base and things like that. So if the patient spends some time building their base, we're investing all this money in them, they're not seeing enough patients, and then they, move on, and then we have to rehire somebody new and train somebody new. So like retaining staff so that they feel like safe and comfortable working in the clinic, and they feel like their decisions are respected is a really important part of making sure that we actually, keep the physicians and therefore increase the amount of patients that we see.
Just a question for, almost I feel like you guys should be the candidates in city council. Now, I grew up here. I've been here all my life. Now, the hospital in Seward used to perform medical procedures. If somebody needed an emergency C-section, a minor surgery, it was performed here. Now, you're talking about income. Now, if you were in a position to perform more, procedures and treat people more, than just be a triage and send people to Anchorage, wouldn't that bring you more income, and wouldn't it, because it doesn't seem like, any more people are really treated in Seward. They're put on a helicopter and they're sent out if there's any treatment needed.
Well, that's a big question.
You want to talk about improvements in healthcare,
Right. So I can tell you that the way that the hospital is set up here is a critical access hospital. So that basically the way it was built and everything else, we don't have the room within the hospital for to be able to do procedures and those kind of things. And being a critical access hospital means that we are only allowed to keep people about 4 days. Anybody that is critical, we don't have the ability to keep because we don't have an ICU. We don't have those kind of abilities, unfortunately.
I wasn't talking about critical.
I know. Basic stuff,
procedures.
we do keep, but we don't have the ability to do procedures. We don't have a procedure room. That's one thing that is a big discussion for us right now, is being able to do that. But we're gonna have to find more space to be able to do that, and to be able to bring in more specialties to be able to do that. But we would like to be able to do more.
I think you guys need an anesthesiologist, and in order to do any procedures, you need to have an anesthesiologist on call. So
Yeah.
that's more staff and nurse anesthesiologists.
But how does that compare to the cost of these helicopter rides? You're talking about $30,000 rides, sometimes on a daily basis,
When the life flight can land, I've seen them be turned around quite often.
Yeah, that's another thing too, I have, I know people that have died here in Seward because they couldn't get out on an ambulance, they couldn't get out on the plane, and they died because they don't have the proper treatment here.
Yeah, absolutely. And that's why one of the things I want to make sure is we have, 24-hour EMT and paramedic service in town.
We used to have a hospital that would perform an emergency appendicitis surgery. They would do emergencies.
Yeah.
They would perform emergency surgeries that need to be done.
Yeah.
So it seems to me we have gone down again.
So could I direct this question a little bit to planned expansion or anticipated expansion? we're kind of dancing around the issue here. I don't know if you guys can speak to this directly, but Providence is looking at taking up more space in that building at some point, and they're looking forward to the new clinic being built so they can do that. So maybe we could address the dynamic between those two things, or not. I don't know if we can address that.
I can speak to what I know of, because I haven't been involved in a lot of those discussions, just to be truthful. I can tell you what I've heard. So there are plans, once the clinic, you know, moves on, we do have plans to have a procedure room there and to be able to do some outpatient procedures. As far as being able to do emergency procedures, I don't know if we're gonna have that ability, to tell you the truth. Because you just have to be able to have the staff for that, like an anesthesiologist. You're gonna have a surgeon, those kind of things. Those are things that we would have to build up, but we would have more space. We would like to do more outpatient clinic stuff. We would like to bring down cardio. We would like to do like stress tests, offer those kind of things. We would like to bring down, you know, maybe ortho to come down once a month, those kind of things, to be able to come down and do some procedures, minor procedures. I don't know that we're gonna have any kind of surgical unit that is not like a pre-scheduled surgery of some sort. That's kind of what we're talking about. We're not talking about, you know, having a 24/7 surgical unit at this point.
Well, let's talk about the 24/7 services that you have now, the emergency room, which is frequently at capacity or over.
Right, true.
I have a question about that. When the cruise ships are doubled, how are you gonna handle that?
It's a very good question. You know, we have been in discussions about that, because right now, we've had several times that we've been at capacity. Just to be honest.
One time.
Yeah.
Has the jail closing affected you?
You know, it did at first, because we had to do the medical screenings, but it's not now, because they're doing the medical screenings now. So that's not affecting us too much. The biggest problem is gonna be when we have this big expansion. We have more cruise ships coming in. I don't know where we're gonna put them, honestly, or where we're gonna get the staff. Right now, we have enough staff for what we have going on right now, and the size of the building that we have.
Is Providence for sale?
The Providence is not for sale, and actually, Providence manages the hospital. The city owns the hospital.
And they're planning on selling it?
Well, Providence manages it, so I don't know what the city plans on doing with it.
What happens if it's sold? Then what?
Well, Providence would be the likely buyer, so.
They have to come into a new contract with the same situation? It'll just keep cycling over?
It would be Providence that would take it over if they bought it, but there's.
They own Mountain Haven and Providence all together?
So the city owns long-term care, the Seward Mountain Haven, and owns a hospital as well.
And Mountain Haven brings in a lot of money.
It does.
So why aren't they contributing to the hospital here?
They do.
Like, why don't we have more staff than that stays year-round? Why don't we have housing for the nurses that
Good
come
question.
in? Because there's people living in cars that come here as nurses. So there's a problem.
There's a huge problem for housing. Huge problem for housing.
Especially when Mountain Haven is making that much money.
There's no housing available, honestly. You know? I don't know. We've bought units, we're renting units, you know? But we only have a certain amount that we can take over.
Yeah,
And we put our staff in it.
You offer a good amount of money for housing, I know that, and there's still people living in cars.
I know.
I'm not blaming you at all,
Right.
I'm just asking.
Yeah, yeah, and
This
it's,
should be
I
a
mean,
housing complex of some sort, specifically for the people that are working for Providence.
yeah, and there's been
Like a
discussions
whole
about
building.
that.
Like the one right behind Providence.
Right, yeah. No,
That
yeah,
would make
no,
perfect
totally.
sense.
It would totally make sense, and we're actually discussing it, but as far as I know, there's nothing that is definite. So any ideas you have, I could bring back to my team and we can talk about, and I think that's an excellent idea. Thanks for bringing it up.
Well, how do you translate local issues to the hierarchy? The hierarchy is in Anchorage or is it in Rome? Where?
No,
And just to clarify, the community health center is a separate entity.
I understand that.
Not part of Providence.
Particularly with Providence, which is connected to the Sisters of Providence in Anchorage, which has been building buildings for years and years and years and years.
Correct.
So how do you communicate local needs to them?
You know, basically, we have a lot of meetings with them because now we're regionalized, and so we do a lot of things together. Like my boss is Helena, who's the administrator here, who actually speaks with the CNO, CFO, CEO up in Anchorage. And you know, they have those kind of discussions. And I am not privileged to all those discussions, you know, so I can't really speak to a lot of that. I do know that, you know, we have a lot of meetings, probably more than I like to discuss, honestly. And just a lot of it comes from Anchorage and even above Anchorage, because we're not just the only entity here. We're also in with Seattle, Washington, California. They're all kind of in it together.
But there is, Providence does have a community advisory board. And I believe you can probably go on the webpage and figure out how to sign up and get on that. But they do, there's 7 or 8 people from the community on it
There
now.
is.
And they have input into what goes on in Seward from Providence, and they get to meet with the higher ups in Providence.
That's a local advisory board?
Yes, yes.
Yes.
We do have our Kenai Peninsula Borough Assembly member here who would like to speak up as soon as Wolf gets it plugged in.
Yeah, I'm gonna do that. I'm also gonna ask another question here, which is, it seems like we have some timelines that are driving kind of an urgent necessity to deal with some of these issues.
Oh,
One
there
is
you go.
Oh, there we go, yes. One is the,
See, she's good at problem shooting. It's actually your moderator.
one is the expiration of the contract, the lease for the Seward Community Health Center in the hospital's end. And the other one is the incoming, the groundbreaking and the construction that's gonna bring in all this cruise ship traffic, in, I guess it'll be 27, right? Before we'll see that, so we got a couple of years. So we got these-
26 is what they're.
Okay, 26, okay. So, I mean, those are a couple of things that it would seem like would create an urgency to deal with some of these. Is there a task force that could be organized with the city? There's money, there's head tax, there's all these different topics.
Could I chime in right there, just to, I'm Cindy Eplin, Kenai Peninsula Borough Assembly member, District 6. I cover Turnagain Arm to Lowell Point to Sterling. And when I got on the assembly, one of my goals was to help. Craig and I talked several times about how the borough could help the city hospital, our hospital, because, you know, I knew people that worked over at Soldotna. I knew that Homer had a big hospital. And I came to realize when Craig and I asked once if we could find some way to get some of the grant dollars that were constantly coming in. The other 2 peninsula hospitals are funded through service area taxes. They pay a portion of their property tax, or the mill rate goes to those hospitals. And they are just booming. I sit on the assembly and hear quarterly reports for both South Peninsula Hospital and Central Peninsula Hospital. Now, again, if we were to get a service area tax, it would go to the people in the area that is serviced by the community hospital and Providence. But then we've got the increase of the tourism and the cruise ships, and how do they pay their fair share? So it's an idea that it may be time to look at, because that's how their buildings are owned by the borough, like this would be owned by the city, and then the people in those service areas pay a lot of money into a fund that is managed by the borough that helps pay all of the bills, plus they have their income, and we get quarterly financial reports from them. So I'm just throwing it out there because it may be time for a broader discussion on that.
Cindy, do the ratepayers get a discount if they are members who have paid in for the service district? Do they get a discount for services?
There's several ways you can get a discount at, I know Central Peninsula Hospital, you get a discount if you pay at day of service, you get a discount if you're, like a sliding scale kind of discount. But, they ask at the meetings how they are, better servicing the taxpayers and their finances.
I mean, I'll speak to future plans for the summer and helping to kind of minimize the impact on the ER. We're talking about bringing in a full-time summer provider, so that would be 4 in a perfect world, during the summer months to cover that extra incoming flux. So that is in the works, big ideas, but that would be an ideal. But then you have to find support staff and all that, but that is in discussion right now of trying to help cover that cruise ship burden.
I have a simple idea. I had somebody that's too shy to speak up, and a member up there knows who I'm talking about, 16-year-old, who came in on his bike to talk to me and thank me for being on PACAB. I was impressed that a 16-year-old knew what PACAB was and was watching the meetings. And he said that in the summer it was so busy, Safeway ran out of his insulin. So how many people here have had trouble filling a prescription lately?
In the summer.
And it's in the summer. The cruise ships do not accept health insurance. On their behalf, that's very difficult because they have so many nationalities, thousands of insurance companies. But I would like to start something called Tours of Best Practices that Juneau and Whittier have already. And one of the suggestions that I had is to let everybody know getting on that ship before they leave to get on the ship, before they leave their house, before they leave their town, to fill their prescriptions, because these small towns can't handle that. Poor people at Safeway, they have all told me, yes, they see a huge influx and they have a very difficult time keeping prescriptions filled. And that's just one aspect of it. I heard 6 medevacs in one day. 7th was canceled. 3 of them were cruise ships. And this even, I don't know what can be done to help on that. But maybe the part of the head tax for cruise ships should go towards part of the infrastructure as other towns do. We also have a very low head tax. It's 3.5%. Other towns are charging up to 12%, and some of it goes towards the infrastructure.
The head taxes are, the way I understand it, are somewhat consensual. Because they can find, there are some reciprocal benefits that have to be built in this to keep everybody happy. So if we're unhappy on this end, then that reciprocal nature of that relationship should be addressed.
I have a question about Providence. Mountain Haven, everybody there is on Medicare or Medicaid. They don't even take Medicare. And I know 4 residents from Seward that have to go to the Pioneer Home in Anchorage or to the Valley. And it's not fair that even if we have insurance, we can't go to Mountain Haven. And everybody, if you do have to go, if you can go, you have to be on Medicaid, and that I don't think is right. And you guys say, oh, that's a moneymaker. Well, the taxpayers are still paying that money.
You think with the influx of that many tourists coming in that there's gonna be a huge problem at the hospital with all the sick people coming into town, like by the 10,000 per cruise ship? Think that's gonna maybe have a little impact on us here?
I think it's probably gonna have a huge impact on us.
And then plus we're flushing all their shit down in our ocean right there. So that's also gonna be a problem for the locals that live here.
Yeah,
pardon my language.
I would like to say that Christy wanted to be here, and she could address some of these things, but this is a conversation obviously the city should be involved in, right? Yeah, so.
And Christy told, well, she is listening, or she will listen, and she will address any questions. We're gonna be doing an interview again. We've already done 2 interviews on the quarter tomorrow. Under Sacktown Talk, it's the live interviews, quarter tomorrow, 1 and 2. And I would advise people to listen to those, and that might answer some of your questions or create more.
Yeah, the gentleman with the question. I could go ahead.
Yeah, I got a few, I don't know, 5, 6 questions here. Just trying to understand, are pretty much all these positions, your positions and the positions that need filled, are they contract positions?
Are you talking for the hospital?
Yeah,
So actually right now through the ER, we're fully staffed.
okay.
And through the summer, we actually hire temporary help. So we don't necessarily use an agency whatsoever. We basically have started hiring our own nurses that we've had work for us in the past that, you know, were travelers, but now they basically work for us. So they come up, they do a 13-week assignment or as long as we need them to.
Yep.
And we pay for them to have housing, and we pay for them to have a car. And that's how we keep staff here in the summertime. That's our 3rd shift. Usually we only carry like 2 nurses for 12-hour shifts. We'll have 2 nurses during the day, 2 nurses at night, but we have that split shift, which is like 10 a.m. to 10 p.m. to cover that busy time as well when we get those influx.
And then, we have quite a few traveling nurses stay at our place throughout the winter. Is that trending down? Is that needed just because we can't get the full time? I mean, like, or is that trending up? You know, I guess it's more of a turnover percentage.
It is.
Do you have an idea?
Right, so a lot of that is with Mountain Haven. On the hospital side, we don't have that problem per se. And Mountain Haven is doing better. They still do have travelers. They have traveling CNAs as well, but one thing they're doing is they are training their own CNAs now and trying to bring in local people to work. And you know, I just personally just hired 2 CNAs from out of state, and then we relocated them. That fills all my shifts, and so I no longer am in need of CNAs, which works great for us. They also brought up their daughter who wanted to go through the CNA program. So, you know, we're trying to grow our own, we're trying to recruit, we're trying to get people here to work.
Yeah, and I guess I just kind of was trying to get a feeling of what, you know, which way are we trending on our turnover, you know? Is it staying the same? Is it been a spike either way?
Right.
I don't know.
I can speak for the hospital that we're not having a problem with turnover. We're doing well. Actually, right now, my problem is I probably have too much staff, and I don't, my staff is upset because they're not getting overtime like they were,
And then,
because we're staffed.
last question, and it seems to answer itself, but what is the greatest problem in Seward?
I think our biggest problem is probably, I would say, not having 24-hour like paramedic service or like transports, those kind of things. We probably wouldn't fly out as many people if we actually had ground transport that didn't have to come from Anchorage, but came from Seward, and we could send people down.
You're
And then we
talking
wouldn't
about
have to keep them.
transfer to Anchorage, not in town or out of town.
I'm not talking about in town, I'm talking about our problem with weather hose, those kind of things within the hospital, because they can't always fly, as you guys know, our weather's not great all the time. So we get stuck with some really sick patients. We get stuck with patients that aren't that sick, but still need surgery, right? And they could take a ground transport, and they could go, you know, for 2.5, 3 hours. Instead, they have to wait 6 hours because they have to wait for a transport to come from Anchorage to here and back.
I would also point out home care would be really good, because home care, you have people going into people's houses. So we can find problems before they're requiring to be medevaced, you know. So, so that sort of, I mean, we're sort of, our staff does that, you know, we go to people's house, but we're short, we're short staffed that way. But, if you can prevent a hospitalization 3 days before it happens, you know, and you can safely transport them by car to Anchorage, that would be a big, help. And primary care is where that's in, you know, so we should be doing that at the community health center.
So if Providence is fully staffed and you don't have a turnover problem, what is the difference between the clinic and Providence? Why does the clinic have such a high turnover?
When you say high turnover, we
Are
don't,
all your positions filled too?
no. Right now, we have about 4, I think, open positions, but unfortunately, 2 of them are providers. And that's where the stress is coming from. Our turnover rate is right about average, right to 8 to 12%, where we've been in the past few years. It's just that we're having 2 of our medical providers leaving at the same time, and that's causing some stress. But we do have contract staff coming in to cover their shifts, and we've been interviewing some full-time providers that we expect to see, you know, probably in the spring, is when we should have the positions filled by.
Are those providers moving on and stepping up, moving out of the city, or are they staying? I mean,
One's staying and one's moving out of the city.
This is my chance to speak as, on the clinical side, for our patients that are worried about this change. I do want to reassure you that we're still gonna pick up the phone. We do have those 2 covering providers right now for those 3 months while we're trying to find those full-time providers. But we have plans, we're not gonna deny your prescription, you will get covered. You know, we're here to take care of you and make sure our community goes forward from here. So I did wanna speak out and say that we're still gonna answer the phones. We're not gonna kick you to the dirt. We're here for you.
I'm one of those living providers, and I'm trying to like tie up all the loose ends, making sure people are getting where they need, making sure people are being covered by people that's appropriate for them, you know, for their different levels of care and things like that. So, yeah, yes, sir.
Does anyone have an estimate of the size of housing complex that you would need to cover both of you? You know, is it 4, 10, 12, 20?
And is it a monolithic complex, or do you need more than one because of territory between different organizations?
I got asked this at a city council meeting recently too. I think I said somewhere between like 6 to 8 just for the health center, and in Providence, you already own several apartments throughout the community.
We do, and we have, I wanna say, we have, out on Bear Lake, we own 2 different, complexes out there. And that's where we put our longer, like our new employees out there. So what we do is we give them 2 months, and then they can extend out to 6 months to find housing. But, you know, it's just not enough, you know?
So you characterize it as kind of a touch and go situation. It's still not quite, it's not like stable long-term housing.
Right.
You've got all your positions filled, but it's kind of touch and go out there.
It's touch and go because once you hit that 6 months, we have other, employees coming in. We have, because we share also with long-term care side. So they have new employees coming in. So after that 6 months, you have to find housing, right? And that's not easy to do here in Seward, especially in the summertime.
I think the struggle is 2 and 3 bedrooms. You know, we just had a family relocate from the lower 48, and they're struggling. And, you know, they don't, you know, a 3-bedroom is $2,500 a month. Like, who can afford that?
Right.
So that's the biggest struggle.
And there's
It's the
vacancies in the
families.
low-income housing of units that big, but they would make too much money.
Right.
I think there should be something that could be worked out on that.
Right.
We've also had staff whose housing has been sold out from under them. And then they have tremendous difficulty trying to find another place.
And you're talking mid to lower income positions in your organizations, right? The higher income positions can manage to buy a house still.
Not necessarily.
Not buy a house.
Oh, really? Yeah.
Oh, yeah.
Yeah. I know people who
Yeah.
make 6 figures, like the principal, who could find a decent place that was adequate, so.
I had a hard time when I moved here.
Nicole Lawrence did a great presentation to PACCAB, I think, to start with, on housing costs and how much you have to make to like build a house in Seward or buy a house in Seward. It's tremendous. Yeah, it's a huge barrier.
My personal experience when I moved here, I rented a place for a couple months. The place burned down literally a month after I left. So I was nearly homeless for a while, the first homeless doctor in Seward, I guess. But we made multiple bids, and they were getting like massive cash offers from Anchorage for Airbnbs. And it was really, really frustrating and I said, I'm gonna be the local town doctor. I'm gonna be the local town, please, please listen, heed us, but I couldn't match the savings of big Airbnb, monoliths from another city, just buying up space and renting it out.
Why are you leaving?
I'm leaving for certain reasons. I don't know if this is the right avenue to discuss. I'm gonna, keep it private for now, but there are, avenues that are being addressed right now. If that doesn't work out, I'm happy to talk.
I guess my question is, and why I'm hitting hard on the number of units that you guys would think you would need, is because in the city of Seward, there's not a lot that can allow more than 4 units. And you'd be hard pressed to find a lot that will allow 4 units. So if we had a number, a guesstimate of a number, we could start to push the city to say, you need to at least make it available so that it has a viable option to get a complex, whether it's 12, 16, 20, I don't know. I do know personally that Providence purchased a large studio building in Fairbanks, answered their issue. I would see the same thing here, but, it comes back to, well, if you can only build 4 units, it's not gonna answer. So I guess I'm kinda asking, again, an estimate, a number. I know you said you gave a presentation, but, if we're gonna ask for a number, we need to kinda have a good guesstimate so that they can get that nudge of pushing over and designate some lots or a lot that will change zoning.
I mean, this is so much bigger than just healthcare. This is our education system. This is a huge issue. I think it's less of how many units and more of the affordability, in my opinion, but
Right,
I try not to bring politics into my.
viability too, like,
But,
knowing that a larger complex can provide a lower rent.
right.
So by them castrating it and leaving it 4 and under is also the issue. So if they would, like case in point, like Cole produced 2 really nice 12 units here. They're probably the best rent affordability in town. Why? It's affordable, it's also a viability, it's more than 4 units. But again, I think, if we had someone like you guys telling the city, hey, we need 12, or we need 16, that might push them over the edge just versus one citizen, that's looking for an apartment.
I would say at least 16 to 20 for all the needs, as far as long-term care and what their needs are, and then what we would need and what the Seward Community Health Clinic would need to be able to house our employees that we need to bring in.
Well, and I don't know where North Star is too.
Right.
Because they're struggling with adding services with their new building.
Who owns the building behind Providence?
The old luxury?
I'm not sure. The one that probably has 20 units in it?
Oh, I think that's Glacier View. Yeah, yeah.
So there's no,
Mm-mm.
it's full.
But for more information, planning and zoning had a work session
Oh.
two or more weeks ago where they talked about housing, and I did present there and tell them how much housing we needed. for the health center, but they had some really good information. If you go back and watch the YouTube video about the progress that's being made on top of the hill above Doorway. There's some really good progress happening there, and there's a lot of lots. There's still lots for sale up there, but the Coast Guard bought up a bunch, and the state bought up a bunch.
Yeah, I'm really trying to hammer home on a complex, a apartment building that will bring down the rent. So I understand that's a great addition in the last 4 years, they've added for single family residences. But I know from my past in rentals, you gotta have a certain amount of apartments if you really want to help out and bring down this rent load. But again, I went to Courtney last week, head of P&Z. I said, show me a single lot that there is available today that I could put greater than a fourplex, and there is none. But they could make it that way, but they're not going to just because I'm asking. Maybe if you guys ask, because you're providing a service, will help.
This whole big lot that's just a parking lot out here, isn't that owned by the city?
I don't know.
The Ray building? Oh, so they just own it and they don't do anything with it?
Before
And we
go
allow
on-
that?
Before we move on too far, I would just like to say I'm sorry to lose Dr. Harkov.
Yes.
I'm sorry too, thank you.
I would like to see somebody continue with your free classes for diabetic. I've seen that make changes in, somebody 16 and somebody in their 80s. That was awesome, it was a good preventative free class, that was great.
Judy, could you raise your hand, please? Because she was really, she's shy, but she was instrumental in having it happen. She's in the green there.
Right here?
Yep.
Okay, go ahead.
So she's our case manager who is, and she doesn't want me to tell anyone this, but she's an excellent cook. So it's culinary
Oh, you've
education.
given her credit for the class too.
Yeah.
Thank you, yeah, thank you.
And that mic works now.
Questions back here?
Just would like to bring up my mother, Beverly Dunham, would really like for me to say that she's totally appreciated. She used to go to Mountain Haven for wound care, and they stopped their program on wound care, and then you got at the clinic Andrea, who was phenomenal, and between Andrea and Harsha and Lindsay and Judy and a couple of others, I think you saved my mother's life. You certainly saved her leg. And if it wasn't for the personal care that you gave her, I don't think she'd be with us today. And she really, really wants to
Thank you.
get that props to you.
I appreciate it. We appreciate it.
I'd like to add one other thing, kind of doing a total flip on something that you're doing right. Thank you for having the sexual assault team in Seward. That was just absolutely horrible. I spoke up many times in front of council with my little sticky notes of other town that have this, other towns. And thank you for bringing that back to Seward. And very proud of my ad that I did for the mammogram machine. Can we talk about that? Because that's something that's a big improvement. No more mobile bus.
Absolutely, there's
State of the art.
absolutely. Yeah, now in Seward, we are doing mammograms. They're in the building. So, yeah, it's a great program. We also have echocardiograms that you can also have done. That's a new program for us. We're also gonna do an outpatient wound care clinic as well, so we're gonna pick that up. And we should have that opening within the next probably 2 or 3 weeks. We're just finalizing everything. So yeah, it's huge because so many people were missing out on their mammograms with just the mobile bus coming down because they were only coming down like twice a year, and so
So the
many
new
people missed
equipment's a
them.
lot better too.
Yes,
And people no longer looked at and said, to find a family member to drive you to Anchorage or so on, and to
Absolutely.
get a rape kit. Seriously, why was this okay for so long?
I don't know. I don't know, but it's not okay anymore, is it?
Thank you.
You're welcome.
So, we've been running for quite a while on this particular topic, and it's great that you all stepped up and formed this panel. But I'd like to have Harsha, because dipped his toe in all the water, or many of the waters here recently. Talk about the different orbits of healthcare in this community. We have Providence, we have the clinic, we have the other clinic, we have, so people are a little confused about what's going, what these different parts do. And then we have Brent, and there's another practitioner in town. And you just investigated, you were kind of looking at maybe going into private practice. So if you could just kind of address the different kind of planets that we have here.
Yeah, so this is the really interesting thing about healthcare, and this could go on for a while. And it's kind of funny, when I went into med school and graduated, I had no idea about any of this. I learned medicine, and then a lot of medicine is actually how insurance works. And a lot of everything we're talking about is about reimbursement rates and who reimburses what, and how much is reimbursed for the same action done in the emergency room versus done outpatient. Like, you treat a cold in the emergency room, it costs 10,000 times more than treating a cold in a public clinic, but that reimburses higher than treating a cold, the same cold, in a private clinic. So these are all obscure, arcane rules, which, we lose our mind over every day. It impedes healthcare. Some people are getting in this money is important for in terms of running the clinic, and I get that, but the doctor cares about care and balancing those two, so we have a balance in the number of patients that we see, make sure we're providing good care versus making sure we're seeing enough patients to keep the clinic going. These are all really important things to balance. You can't, because basically in an outpatient setting, you get reimbursement on the number of patients that you see. So if you see one patient an hour, I'm just going to make a number. Let's say we get reimbursed $200. But let's say I see a patient for 15 minutes. Let's say I get reimbursed $100. So what makes more money, seeing one patient for an hour or seeing 4 patients for 15 minutes? Seeing 4 patients for 15 minutes. So and this is not our clinic problem or anything. This is just the way the health system works. Insurance is I will pay you for seeing a patient for 15 minutes rather than I will pay you for saving this person's life or improving this aspect of their care. None of that means anything because it's all intangible. So because of that, there's a big flaw in the healthcare system. And honestly, this is what leads to a lot of distrust, because it doesn't matter if you're the smartest doctor in the world. You're not going to make good decisions if you see someone for 15 minutes. How many questions are you going to ask? How many answers are you going to get? You guys know the way I practice care. I'm asking 1,000 questions. I'm grilling, I'm talking, for a long period of time. Sometimes it takes an hour. Sometimes it takes 15 minutes. It depends on the issue, and that's not how reimbursement is done in the world that we live in. And that's an issue with the healthcare system in general. We should be paid based on outcomes, not based on the amount of time we see someone. So, but that's a little complex. I could go on forever for that.
You sound like me with the free market.
And I'd like to say something too. I'd like to thank you guys for being up there, because really you guys should be out here, and this should be our city council members up here, and you should be telling this to them.
Yeah.
So I'm kind of puzzled as, it's a town meeting. Maybe when voting time comes up, people should think about that, Yeah.
Well, short notice on their behalf.
Well, your question was about the structure of Seward's healthcare system. So there are several primary care providers in Seward. There's North Star Clinic, there's Lacuna Family Medicine, Dr. Flynn, there's us, and then there's Brent with Glacier Family. So those are the 4 primary care clinics in Seward. You can have your primary care provider up in Anchorage too. That's an option. And the idea of primary care is, managing your health as a whole, and preventative health too, right? We're moving more towards preventative health. If we take care of your preventative health, there's less possibility of a worse outcome. So that's kind of the structure of Seward. And then there's the hospital, which helps us with all of our outpatient. They do the labs for North Star. Brent does his own labs. Brent has his own x-ray. But the hospital has the CT, the ultrasound, the mammogram, the infusion clinic, which is awesome. Thank you.
We have 2 dentist offices.
The dentist.
One's been here probably the longest running, or already probably the longest running medical person in Seward.
Absolutely.
And then we have, chiropractors,
Mhm.
so we all miss Dr. G.
And then PT, OT,
Yeah.
yes.
PTOT.
Physical therapy, occupational therapy.
Okay, right, yes,
Sorry,
yes.
yes, both with advanced physical therapy and, up at Mount Haven, so, and speech therapy.
That's right.
What am I missing?
Nutrition.
Thank you, nutrition. I think that's it, so that is what is available in Seward. The rest of it goes to Anchorage.
So what's the differentiation though? People get confused. They see North Star Clinic, they see the Seward Community Health Center, they see Providence, they see the private practitioners out there, Flynn and Ursel. And there seem to be different constituencies for each, but maybe different types of care for each. How do you differentiate? How do you choose, you know?
That's your choice. You get to choose your provider.
Okay.
Yeah.
So all the doors are open to everybody on all fronts?
I don't know, the doors are open for us. So, I'm sure, yeah, I can't speak to the other providers, but we are accepting patients, so. And that's Seward Community Health Center. So the struggle with that building, especially since it was that Providence clinic, is that like, a lot of you all think that Seward Community Health Center is Providence, and we are separate even though we're in the same building. And that happened right after I left there as a CNA. Because I worked at the Providence clinic before it went to SCHC, so.
And I would point out if there's any confusion about like what your needs are and where you want to go, it's good to ask that provider, you know, so like, being a PA or an NP or an MD may not necessarily matter as much as what are you comfortable doing as a provider, you know? I like doing this specific procedure a lot, but I don't like that procedure very much. So it'd be good to like just communicate with, hey, I need this done, you know, I need an injection in my knee, or I need care for my diabetes, or I need, screening for this, so, and then that way we can point people in the right direction, drug addiction counseling versus wound care, certain providers do more of one or the other. I believe Brent does sends over his wound care patients to us at the clinic side, so he has his comfort level. And we'll send certain patients to him. He does a lot of the CDL training and things like that. So I mean, we're working on that as well. So I'm just saying, like, we all have like different specific things that we're either good at or trained in versus other people.
And if you're coming at least to Seward Community Health Center to find a primary care provider, what we call that is an established care appointment. It's a longer appointment. You get more face-to-face time with that provider, and that's your chance for the both of you to interview each other and see if you're the right fit. Maybe that's not necessarily gonna be your provider because you guys didn't feel like it was the right fit, but that's your chance to interview each other. So it's called established care appointment. That will help you get the right type of appointment.
We have a group of, they left. No, Hinders had, his students come for credit, but they, most of them have, left. I was gonna ask if they had any questions, because they were being so quiet, but, we did have a large group of young people in the.
Yeah, we should have given our moderator a prompt to give to them so they can get their extra credit, but they left, so.
I'll tell them they were here.
Yeah, we have photographic proof.
They were here for 2 hours, yeah.
So, yeah, I know we miss Frances. She was seemed to be a community clearinghouse.
Frances was awesome.
Yeah, she was like a walking library of just everywhere, everything you need to know about Seward, specifically in the healthcare field. So is there such a kind of a clearinghouse these days? Should people call? I know Providence is not gonna say call the clinic first. Are we gonna get another Frances?
We do. We're actually utilizing 2 people to fill Frances' but her history, she had so much knowledge about who to call in Seward for which things. We're still trying to duplicate that. But the Prevention Coalition has a lot of resources, but as do our staff at the health center. And if you call and ask for outreach, they can outreach and enrollment staff. They can help find you places and find you solutions to things that you'd be calling about. Whether it be rides, housing, how to get Medicare, Medicaid, how to get food stamps, all that kind of stuff, we will handle that.
So the agent,
Yes.
so you've got one in place, or you're
We're
replacing?
training, yeah.
You're training, okay, great. Because I know before Francis, it seemed like it was, we had a couple long-term folks down at Seaview kind of filled that role for many years. And then it kind of, then Francis kind of came and adopted that role. It'd be great to see that resume.
Our plan is to keep that rolling, especially with enrollment coming around for the open enrollment for the marketplace health insurance.
I have one question. Last week, I understand that there was a public display of, in front of the hospital, in front of the community center, in support of stability. How is that received? Is it, you know, we don't have a newspaper anymore, so it doesn't really go public. But the intended audience is both the general public and you folks. So how is that kind of display received? I'd like to think that those people didn't waste their time.
Oh, I don't think they did. Our board, and I would, you know, you could write to them and ask them, but they're looking very much so, and we've got people working with us, professionals working with us, to figure out how to answer the questions that everybody's been asking, and try and, you know, work on longevity and work on how to retain our qualified staff. But they did take it very seriously.
In the clinic where you are, on the wall, leading to one of the corridors there, you have a beautiful display of drawings and that laying out your proposed new clinic facility from the concept and design. Where's that at in reality?
In reality, we have $5 million for a $20 million project. We've been to the state twice. We've been to the feds twice, and we have applied for several grants. We're still at $5 million. So our board is meeting to figure out, do we continue to try and fundraise? Do we try and build something for $5 million? Do we come up with some other plans? So we're at a juncture point right now to try and decide what to do over the next few months, but what to do with those funds and what to do to provide more space for our staff.
Thank you very much. Really appreciate you guys coming up and being part of our panel, healthcare panel tonight. We're going to take about a 5-minute or so intermission if you need to use the restroom, get some water, and we'll start back up here in just a couple of minutes with some discussion on local infrastructure.
So, is she still 11? Well, now. Did you receive this? Or did you take it again, or just oh, yeah.
We'll work itself out. Hopefully it doesn't have to get in, but I want to let the process play out. But if it doesn't play out, then we're ready to.
Oh, no, I'm Is it accountable?
Looks like you'll have a favorable response. Sorry. Sorry, I didn't have more for you to do.
We had a professional person, she'd been in Seward. Asian, but extraction. Fascinating, and when I read it, I don't know.
Yeah, I should have brought an extra battery. I didn't realize it ate so much battery. The other ones are holding up though.
Yeah, sure, and there was a guy with the name on. It doesn't require,
Susie Q. Who wants to know who is facilitating? So Ryan is off camera, actually, to your right, to the right of the screen. Ryan Parsons. He lives and works here locally. And of course, the big mouth in the audience is me. So we're both kind of co-facilitating. And there's another question on the chat. It says, somebody, Czar live stream, where is this? This is in Seward, Alaska. You can find out more at Seward Public on Facebook for one place.
I don't think they ever shut it down. They can do it at Paradigm maintenance cost. It's an expensive plan to maintain, partly because of the nature of usability calls. Very pricey. How does it you? Well, it's mixed. When they designed them, usability had promised them some higher grade calls. Just take the land with refuse, because you've got sellage coal down even in Korea, using it with base. But, an idea that Washington called that, but not Trump's idea, clean coal. It's a mighty totally back, also doing the tax at the borough. Well, if you talk about amortization, I think, because I see that being a very high dam posts they build in southeast, those will run pretty good, but those are expensive too, because
that was 2 hours.
Hydro, front end expenses high, theoretically, the maintenance costs are low. We just finished the job. We need to slow down here talking. I have a hard time.
I should stand with the microphone.
Well, that's, anybody can say that.
Okay, so let's do another half hour. See what this goes. We're actually leaving in November, and we won't be back. So,
All right, if everybody wants to head back towards their seats, we will get started with our final 30 minutes or so of discussion. We're going to move over to infrastructure, and I believe we have a couple of volunteers to sit on our panel for the discussion on infrastructure. So come on in and grab your seats, and if you'd like to sit on our panel, come on up to the stage.
Let's talk about stuff.
What's that? So you don't even need a mic, you just project naturally towards.
Can you hear me?
Just for a little context, we're right at about a year since the residents voted not to sell our electric utility. And so maybe some folks on our panel can comment on that, what's happened in the past year, what potential changes have been enacted, or what's on the radar coming up. And if you would introduce yourselves, we'll start from our left to right.
Our left?
Stage
Not
left.
really. Bruce Jaffa, Moose Pass. I'm chair of the Portland Powers Advisory Board here, and a participant in local government.
Bill Calusa, local resident. I guess I'm really an advocate for climate change and issues that involve climate change. And so heat pumps have been sort of my forte for the last few years, and I hope to see them expand.
Kevin Dunham. I was born and raised here, back when we had doctors. I think Arnie might have been born here too, but probably Dr. Deisher. We had a doctor that stayed for many years, but I had 41 years in the electrical industry, running power plants and control centers. 38 years, I never worked in a room with a window. It was all secure rooms, and then the last 3 years as a consultant, so I got to have windows, so it was great.
Got a question down front.
For those that don't know, could you please explain what PACAB is?
PACAB is the Port and Commerce Advisory Board. It's it is not a commission like planning and zoning. We are only advisory. We cannot commit the city to any action, but we were intended by the founders, and I think Darrell remembers those founders pretty well. The intent was to provide a sounding board and an opportunity to vet ideas and save council some time, and also to take on issues that council wanted to dive into in depth between their works, their general meeting. So I've enjoyed serving with Darrell's on the board and many other people. It was a great opportunity to dig into the things that are important to Seward, and the commerce portion. Of course, we deal a great deal with the harbor tariffs, the mortgage fees, development plans for both what's now called the small boat harbor and 4th of July, correct? But commerce is a broader topic and deals with those things that would enhance the commerce in the city of Seward. Somewhat take a cue from the Chamber of Commerce, and we look at what actions they take and then help advise them. But there is a portion in our mandate in the code that talks about the quality of life of the city of Seward. And in the past, we've taken that as a very important mission. Again, we're an advisory board to the council, so we only can take on those things that council prefers us to take on. Does that help?
Thank you.
So I've kind of got you guys pegged. I've got airport and maybe the new cruise ship terminal, heat loop, and electric utility. So I don't know if you guys kind of want to give a thumbnail of where these things are at, and just for people who may not have been paying attention or be aware, the airport was the subject of a lot of meetings and a lot of lobbying at the state level, and it's kind of slipped off the agenda, it seems like, or at least it seems that way. So, but I keep hearing about it, about the need or the desire for air service here, for example. So are we going to see that? Is there any change happening at the state level? Are people retiring? Can we get some movement? I mean, those are the kind of questions I keep hearing.
Seward is unique for a town this size to have 2 runways. It developed over time, and if you look at historical records, it somewhat grew along the banks of the Resurrection River. A long runway at about 4,300 feet was developed, which allowed somewhat larger planes like C-130s to arrive here, which are the Hercules aircraft, which were important to the city. And after the earthquake, the city leaders felt that it was very important to have the capability of heavy lift aircraft. The smaller airstrip is currently 2,300 feet and is a slightly different orientation than the long runway. When Resurrection River started to meander, well, not meandered forever, but at some point.
Meandered without break dickraft.
Yeah, correct. And it essentially undermined the substrate of the airport. And the long runway, and if you look at it from the road, it's a sway back. The gravel has sort of eroded, the fine gravel is eroded out, and as a result of that, the powers B downgraded the weight limit, and you don't see any Hercs in here anymore. You don't actually see any large jets. You'll see small jets, Lear jets, and the commuter jets, but not like before. I was part of an ad hoc group when Chrissy Terrier was the mayor, and we had a revolving door city managers.
Excuse me.
And we advocated to maintain both runways for the betterment of the community. Again, we ran into federal regulation and a very recalcitrant Department of Transportation, State Department of Transportation, that decided that they would only accept a very narrow interpretation of what was good for Seward. At that time, there was a low aircraft takeoff, and part of it was because the runway had been restricted. There wasn't enough use to justify 2 runways, so the state opted to not use either runway and build a new one, but about 10 feet over to the east from the current one, and make it a little bit longer, acquire property, disrupt businesses on the north end, acquire property on the south end, but they ran out of time and money. And yes, people who pushed for this project have retired. The Department of Transportation has other problems, and their funding stream has been directed towards other places. So a prediction on the airport renewal, I think, is impossible. If there's any, in my mind, if there's any real reason to think there's going to be a change, it'll be because of activity in the North Pacific and bringing defense vessels and military into the Seward. If you bring Navy boats in the Seward, they're going to want to bring larger aircraft in the Seward, and that could happen overnight. So, as far as that goes, I don't see any movement, and quite frankly, on a totally different topic, I have interaction with DOT because I live in Moose Pass, and we have our own problems with DOT, so I do know those people, and I do talk to them, and I hear nothing that says the project's moving forward.
So would your estimate be that no news is good news at this point?
No what?
No news is good news? No movement?
I'm not a no news is good news guy. I think I'd rather see a positive approach to this thing, but
well, rather than demolishing things.
In that regard, probably.
Yeah.
Probably, but they've already acquired property from some of the property owners that they more or less intimidated into selling. They've dealt with some boundary issues that legally remove some access to some of the beach between the railroad, the city, and the Department of Transportation. It's a cobbled up mess.
So the DNR get in there too, or do they?
Yeah, DNR has a little bit to do, but mostly in the north end, I believe.
Do you think that there will be an air service coming to Seward? There was some talk about that, and is there still a civil air patrol?
What?
Is there still a civil air patrol there? That used to be.
Yeah, civil air patrol's still there. My planes are not here in Seward, so quite frankly, I don't use the Seward Airport as much as I used to. I go 1,400 feet of my house that I use.
One of the reasons I'm bald is because the scariest flight I've ever had was on AI flying out of Seward.
Well, that's not quite scary.
And we wouldn't make it. They'd fly out and turn around by the time they turn around.
Well, There was a time, and I remember very well, where Seward had an active commuter fleet. And
Yeah,
I flew in and out of here to the point where when my wife put me on the airplane, my daughter thought the plane was called Bye Bye. So it was Bye Bye Papa. And I was flying someplace within a Twin Otters and things like that. There's a guy in Kenai who still retains interest. I don't have the name at hand, but there's a guy who believes there's a commercial opportunity in Seward, and particularly with the increased cruise ship traffic, potential traffic, and real traffic, and other things that could happen here. Tim Jagelski is enthusiastic. Jag Shipyard is enthusiastic for that kind of opportunity.
Do you think that's possible without radar? I mean, they cannot, that was the problem before. It's feasibly to fly into Seward. You can't do it without instrument flying.
Well,
I mean,
90% of the time you probably could. But that 10% is when you want scheduled air. You're gonna tell somebody you're gonna be there on Tuesday and the weather's no good. That's not gonna provide the service people want. The ILS type approach, this is one of the reasons that the federal airport people and the DOT came to the theoretical arrangement, alignment that they want, is to allow an instrument landing system approach. Most of the pilots who testified to this felt that there was a workaround to that. There's a modified ILS approach, and this is getting over my head a little bit, but there were some modified approaches because the important thing is to be able to stop the landing if things aren't going right. If you're landing down through clouds, you have to have a decision point to where you're not gonna run into the mountain. And there are some opportunities for that. So, but I don't see any of that happening very quickly. There's just no heat under the pan right now.
The DOT made the city an offer to buy some of the property there. The DOT owns the airport. Do you know if that deal went through?
No, I don't.
And so the air service is predicated on having the instrument?
No, this guy, I think this guy was talking about being able to do enough of seasonal flights to justify it. But if I remember the timing, we should have probably seen something this summer that was going to happen. Although, things were delayed by COVID. So
yeah. Phil, could you talk a little bit about the renewable energy and the heat loop project? Because I know that's front burner right now, right? So to speak.
Well, Bruce, I would turn over to the heat loop project. My understanding is it's kind of at a standstill again. The financing isn't looking good until we come up with another plan. But I guess my background has been, my whole career has been in energy efficiency and building science. And when I came to Seward, the economics just kind of like jumped out at me and said, heat pumps are the way to go. The cost of electricity was reasonable, the price of oil was high, and by golly, these air source heat pumps, work in cold climates. And so sure enough, I put in one and monitored it, and put in another one and monitored a few more. And so I've been fairly excited about heat pumps. Now, I don't care if it's ground source or sea source or air source, just the idea of being able to use something that's more efficient and less polluting than burning oil just made the most sense to me. Recently, our electric rates took a big jump, and that bid into our economics, both for the heat loop project and for residential and smaller heat pumps. And I hope we can address that at some point with the council. Because one of my big exciting things coming up is there's two big rebate programs. One's being sponsored by Juno, and it's like $38 million of rebate funds, which lower income folks would be eligible for up to $8,000 rebate at the time of purchase. So basically, they'll get a free heat pump, and the state HFC is going to be managing the federal rebate program for heat pumps, which have similar sorts of deals where moderate income folks will be getting like $4,000, 50% off. So these two rebate programs are coming to Seward sometime in early 2025, I hope. And I really hoping we can get something put together with the city and our utility rates that we can make it cost effective for people to go down that route, because it's a hat trick. If we can save money for the homeowners, especially the lower and moderate income folks on their heating bill, maybe we can keep more people in Seward over the winter. That would be nice. And utilities can still, what?
Moderate income people afford a home in Seward.
Yeah.
That's kind of what, you know.
Yeah, right. I mean, it's just, and so if we can save the consumer some money, and if the utilities can still make some money selling, electricity that they would not otherwise have sold, I mean, they benefit, and so even people without a heat pump are gonna benefit, because their rates are gonna be held at least a little closer to home, by this additional revenue from the city. So, and the environment, because heat pumps are gonna currently use less than 50% of the, or produce less than half the carbon that burning oil does. So
Okay,
the
so
environment benefits.
So that was gonna be my question, let's get to that point then. What is the relationship between electrical rates and using a heat pump? Is it because you're using more electricity, but you're using less fuel oil?
Right, so, I mean, for Seward and it's all climate dependent, I guess, but really efficient, small air source heat pumps, they require about 12 kilowatts of electricity to produce the same amount of heat as a gallon of oil. So at 20 cents a kilowatt times 12, that's $2.40 a gallon, equivalent. So there's, a couple dollars savings when the price of oil was up.
So what is the operational cost on this? Because a lot of times I hear on these projects going in, we get the installation and, get it installed price and up and running, and then keeping it running 5 years, 10 years or so forth. What are you looking at?
I got a heat pump guy here, but he's here with a different
That's
hat
what
on
we're
right now.
town.
To put in a small heat pump is $4,000 to $5,000. To put in a bigger one, $8,000, $10,000, and the price just goes up. If you've got a huge house, you could be spending a bunch. In terms of maintenance really for the homeowner isn't much more than your refrigerator. Because other than keeping your coils clean, there's really nothing else the homeowner really does.
When you're getting a quote to get a heat pump, ask if that includes all the electric to get it hooked up. Because some people are surprised.
And that is the big, because if your panel is full and the electrician's gotta put in a new sub panel and stuff, I mean, it's, there's a couple $1,000 just to get your power to your heat pump, but.
Is this part of the discussion of the city plan to put in the heat pump for, what was it, the library and the?
Yeah, that was the heat loop project, and we've been trying to get some additional federal funding, some grant funding to pay for that.
There's a big push to do that right now, right? There's a grant request going in, or a presentation being made.
This will be common knowledge soon.
We can wait.
No, there's no need to wait. The project is currently in limbo. The filing date today at 1 o'clock Alaska time was not met. And so the design is just about complete, but the construction will have to wait for additional funding opportunities.
And I think my question is more about the operational cost. Was that included in what we were seeing?
Well, it was. When you looked at the coefficient of performance or efficiency, the operation costs of that was a much more complex system than a mini split or air heat exchanger. But there was a net gain from the electrical consumption price from fuel oil. But as Phil mentioned, in any of these projects, and we could be mini environmentalists without even making any, by not using the carbon. We don't
Saving money on your
saving
bill.
money, and it's a kind of a win-win.
And supporting your local utility,
And
allowing them to sell some power.
Well, that's a totally different issue, and it's ancillary, but the city of Seward owns their utility. Kevin may talk about it, and it's important to the city, to the owner of the utility, that there are people buying power.
Let me just give you I have a.
You need to talk a lot louder, Daryl.
No, I don't.
I'll try to talk loud. I have an air source heat pump in my home, still helping get it in there. In fact, I just sit by and watch. But, about 6 years ago, and it's operated well. Easy enough, clean the filters every couple, 3 months, and that's about all I've had to do. John came and did some cleaning of the outside coils for me here, I think, a few months ago, and took care of that. But when I put that in, I dropped my electric bill, because I have electric baseboard heat also. I dropped my electric bill $400 a month.
Wow.
Now, it's only about $200 a month now because of the recent electric rate increase, but it still saves money off what I would be paying if I were operating my electric baseboard substantially. You gotta understand coefficients of performance and all that stuff, but the magic with heat pumps is that for every unit of electricity, you get back in heat between 3 and up to 6 units of heat. And so you're saving substantially that way. And let me tell you, it's comfortable heat. It does great on defeating humidity that we have and mold issues that you have in Seward. It's a wonderful stuff to have. In fact, I just installed a second one, had installed a second unit in my home. I'm waiting for the electrical to get completed on it. But, I can't say enough about, heat pumps. They're something that everybody should be looking at, particularly with the rebate programs and tax credits that are there now or coming online that Phil's talking about.
Oh, I need to correct Daryl on the installation part. I was pretty much just watching too, because we had the Avtech refrigeration class actually install it. Eric was great back then. He was an incredible advocate and got a student.
Well, I helped train Darian Draper with my system gig, so he now is a provider of that little system.
The installation of these systems, though, in a town that's already built out, requires an incentive, some kind of incentive. And these rebates that Phil was talking about, or a cost benefit through utility rates, those are important, and that comes to a desire of the community to support this. Again, you have to speak to the people that make the decisions, come to meetings and talk about it. But, in new construction, am I gonna put in a boiler, or am I gonna put in a heat pump? That's maybe close to the same price. And so you can just strictly evaluate the operating cost. But in a home that you've already got a boiler in, for instance, like in Seward, somehow a person's gotta be incentivized, like Daryl's saying, and maybe you were able to afford to do that. Not everybody is. And the people who need to benefit from this most are the ones who can probably afford it the least.
Well, I certainly could afford it because I whacked my electric bill in half. So payback was free of heat.
You still have funded though.
Yeah. Well, yeah, I know.
Speaking of consumption case,
need
but the
that.
installation's part of the overall economics of this. When you roll the $8,000 or so that it takes to install one of these things into the total cost of, and then you amortize it over the, whatever, refrigerator lasts 10 years maybe. So is it one of these heat pumps last 10 years?
Yeah, they're saying 15. I think if you run them really, really hard, if you put a little heat pump in a big house, it'd be like driving a car at 30,000 miles a year versus 10,000 miles a year.
So right now,
What?
so right now, the electrical rates being what they are, and the install cost, it's kind of what?
It's a wash. I mean, it's kind of operating costs right now are a wash between oil and the heat pump. And I think we just need that little extra economic incentive for people to actually want to put them in. I mean, Juneau got $38 million to provide rebates to coastal communities, and I helped get Seward added to that, as well as some communities on the other side of the Kenai. So to me, it'd be just a shame if we don't somehow take advantage. And that the federal monies, I mean, it's another $30–40 million are eligible for heat pump rebates.
Well, there was money in the infrastructure bill for electrification, right?
Right.
And did the city apply for any of that?
Well,
Did we
that'll be,
qualify?
that money for heat pumps will be coming through Alaska Housing Finance. They'll be the ones handing out the rebate checks.
Well, one of the justifications for this increase in rates was a lot of one-time costs, at least putatively.
Sounds like a segue.
Yeah, are being paid for out of the rate instead of out of these other sources of income, theoretically. So, are there opportunities to go out? I mean, I know that the city has missed opportunities to go and get infrastructure money because of lack of internal capacity to write grants, for example. So, is this a continuum? Is there continuing money to get these one-time projects taken care of without doing it through rate increases?
I don't think so. I think when they started the $20 million project, that if you go back in the history of the $20 million electrical upgrade project, it was never supposed to be just the customers in Seward paying for that. That was contingent on actually getting funding from the state. And how it ever got started to upgrade from 69 kV to 115 kV without help from any other entity is kind of a mystery to most people.
Where was that decision, what level was that decision made at?
You know, at the council level.
Well, wasn't it kind of, we needed to replace a couple of those.
We needed
we
needed to replace a couple of pieces of equipment, right. but that would have been around the $5 million mark, not $20 million. And for a small community like this, to come up with $20 million is, you know,
kind of like we had a leaky faucet. Well, we decided to replace the sink too, and then we
but
decided we needed to.
That's kind of water under the bridge now.
Yes.
I think that in 1 year, the city will be able to try and do another sale if they want to sell the utility. It was very contentious the last two times. The votes were very close both times. The city council had a ad hoc committee that Phil and I and 9 other people were on, and we did a lot of work and looked at how the utility could be profitable, and found out that the utility is already profitable, and that the city actually takes $2 million plus a year and gives it to other departments.
Yeah.
So 50% of the customers, Chugach customers, just about 50% live outside the city limits. So those 50 customers, or 50% out there, are paying $1 million plus a year into the other departments. But we love Seward. I mean, you know, we live in the area and our customers because we love this place.
But it is another Seward tax.
But it is absolutely a tax. Taxation without representation because we don't have a vote.
Right. And the vote that was kind of insinuated during the negotiations for the sale of the utility turned out to be kind of paper, or it was never a given?
Well, you know, we really don't know because they did their negotiations behind closed doors, and we never really found out why the city council pushed so hard for the bid to go to Chugach or to Homer Electric when Chugach's rates were lower. So here's something that's happened since then. About 12 months ago, the city council sent Chugach a letter saying that they were going to end the contract as of December 31st of this year to buy all of our power from them. We've been buying power from Chugach since 1957, I'm pretty sure, when the transmission line.
55.
When?
1955.
When the Cooper Lake transmission line went in, every year, and.
Random thing, but I own the diary of, one of the men who negotiated that, was in charge of it at the time, from way back then.
Really?
Yeah.
So the thing is now, any of the power companies, in order to pick up another 10 megawatts, they have to get the gas for that, because they're not gonna give Seward their hydro.
So they notified Chugach that they're.
A year ago.
That they're gonna open it up, or they're not just gonna buy power?
That they're going to end the contract, and generally, when you do something like that, in the first quarter of the year, you would notify and go out to bid to tell all of the companies that you would like to get a bid, so that they can spend the next several months negotiating with the gas companies to buy the gas to cover Seward's 10 megawatt load. That would be about 18% more gas that Homer would need, and that would be about 12% more gas if Matanuska picked it up. If Chugach picks it back up again, it's only 2% of their load. Chugach is huge, especially after they picked up municipal lake power. But there's no way Homer or Matanuska would be able to do that. And both of them also have to sell their power through Chugach lines. Chugach is going to get paid what's called a wheeling charge when you use somebody else's power lines. So that was an error, and now I think it's a foregone conclusion. I haven't heard what's happening, but surely Chugach is going to redo another contract.
So there was a contract in place that guaranteed rates, and they canceled it.
I don't know about the guaranteed rates, and there's probably a guaranteed rate with certain increases in it.
The contract was more favorable than what they're,
Right.
if they go into a contract now than what they probably will go into is gonna be.
So, getting back to the, that's a question I really can't answer.
Yeah, I know, yeah.
But getting back to the sale of the utility, Bruce and I were on another committee that dealt quite a bit with this, and we felt that the city could still keep this as a profitable utility if you quit taking so much of the money off to use in other places and put it into infrastructure, which I'll guarantee you there is no other power company in the state that takes money from its profits and puts it into some other place. It's great that Seward's able to do that, but at what cost to the electric utility? So we came up with, in our ad hoc committee, how many different companies did we go to? About 7 or 8 of the other companies, even some islanded companies that aren't connected to the big grid.
Cordova.
Yeah, and all of them pay their managers more. So when we did our due diligence and gave our ad hoc committee report to the council, they didn't really even want to talk to us again. It was, like I said, it was 11 community members that worked on it. And the point was, they said, we can't pay the utility manager of the electric company more, because then Public Works, everybody's gonna want more money. But how about if we thought about making a cooperative where all of us own the company? That's the cooperative method is what Golden Valley is, Chugach is, Homer is.
With the board?
With the board of directors, and the problem that I see is that the city council has so much other things going on that they really don't understand how the electric utility runs. And I really think that if we had a board of directors that could focus on the utility itself, they would become an educated group of people that were focused on one thing. You know, everybody has other things, especially Bruce. That you see, we're looking at him like, Bruce would be great to be on that committee, but he's already on so many. But then you get the expertise, because the great thing about a board of directors is that they become educated on that particular thing, and then there's a continuity there. And as soon as a new board member comes on, they go through an education program. When a new council member comes on, they don't get to study the electric system and how it works. Anyway, I'm kind of on a bandwagon here, and I didn't mean to do that, but I've been thinking about this for several years.
So we did strongly advocate a board because, you know, of these issues. And when I lived in Nome, I spent 6 years on the Nome Joint Utility Board, and I spent 6 years on the city council. Well, the city council still holds the purse string to the funding. So the utilities board, we directed our utility manager, hired and fired the manager, and we maintained the budget, but the city had the final approval on the budget. So they still had the ultimate control, but they left all the work, you know, to the utility board, who, you know, some of those guys have been there for 20 years serving on that board. I mean, there was a lot of history on a board, so I would still advocate.
Let me offer, just for the benefit of history, for a lot of years, Seward operated its electric utility under that relationship. It had a electric utility board. It was discontinued by the city council, I don't know, in the early 60s, I don't remember the precise time frame, but for, I guess, political reasons and other reasons, so they discontinued the electric board. But that's a model that could be redone, if that would work better than what we're doing now, and still keep ownership of the utility.
John?
Yeah, I have a couple comments, questions. I kind of heard about this, talking with the linemen, and others, but, the director that we would need, the pay I heard is outrageously low in comparison to others. Has anybody else shared what those directors are being paid, that would be comparable to what this director would need to be paid to fill this position? And then my other rebuff to when the city council says, oh, well, we'll have to pay all the other directors more. Well, I don't think they're taking into account that the city utility is the only one that actually, in my mind, is working correctly, in that it's expanding its infrastructure, getting new cash registers, being clients, coming in, paying, you know, expanding its infrastructure. I don't think we'd be having this housing crisis if Public Works did its part and did 500 feet a year with its surplus tax money expanding sewer and water. We'd have all sorts of extra lots. But my point is, why should a director of, say, Public Works get paid the same as a director that has, you know, it'd be a really easy electrical director position if all he had to do was fix broken meters. Don't do any new gateway subdivision, do this new subdivision. Heck, they installed 3 new poles for me, and, you know, it's spendy. That's the only thing I kind of miss about Golden Valley, being from Fairbanks. I never really had to pay $30,000 to get power into my property, in the sense that they always seen it as their infrastructure, and then I just pay them forever. But I do feel that pinch moving to Seward. But couldn't the quick rebuff to the city be like, we're expanding our infrastructure. We need a director that is not just maintaining Band-Aids around town. And I think if you know, how can they not do simple math of, I'm sure we're hiring a director right now. I'm sure we're having to outsource it, right? That has to cost more than having someone in the position. I guess it was more of a comment than a question, but the only question I really had is, do we have any numbers that we can share with the city of other directors in the other
We
utilities?
did with the ad hoc, we had, all those numbers of everybody. It actually, during the last, iteration before the sale of the utility, the city's current manager had, or the electrical manager had requested several new positions. And we did an analysis of every one of those positions at the other companies. And so we had good numbers on that. Most of them were paid more and sometimes substantially more than what the positions paid in Seward.
And sorry, one last thing. I think there should be, you know, in construction, sometimes there's sign-on bonus or whatever. I think for as long as we've had this director position missing since what they tried doing the sale and whatever, I think that new director is gonna have months, years of backlog. I don't see why the city can't open up its checkbook and have a bonus contingent on a contract for taking care of all this backlog, because why would you be even enticed to take this director position, when I'm sure it's not, up to date, you know?
Well, you sort of asked a question, and it's important. Most of the other utilities that Kevin and Phil have talked about are not strictly city organizations. I think some of them are. The city of Seward falls back on a index wage scale for positions. And when that question has been asked before about elevating the rate for a department head, the guidance from this manual that they're using shows a much lower rate. The rate, the competitive rate would be close to double what the city.
That's what I heard too, yeah.
Now, the numbers are, the current arrangement is approximately an $800,000 purchase order to municipal electric to provide the oversight. The feedback that I get is that, number one, they don't have to spend $800,000. It's a reimbursable hourly type of a contract. But the services provided are creating enough efficiency that they are already saving money even at the cost of that outsourced manager. Now, I don't know if that'll go on forever and ever, and certainly there were some real rough edges that the previous director left. So that could be low-hanging fruit that's being collected. And you're also towards the end of that construction project that ballooned in price, and council continually gave a nod to that increased price as it developed. But it's difficult to see, in my mind, how you could take a utility director, parks and rec director, the harbor master, who are all doing great. The harbor generates revenue, and I wouldn't be quite as negative about public works. They do a fair job, and they deserve compensation for their work. And so what's the right number? I mean, we're in flux everywhere. I know in our company, wages are, you know, you pay to get somebody.
Yeah.
It costs.
Yeah. And my only angst is, I'm a plumber, but my father was Cold Heart Utilities water distribution my whole entire life, 36 years. I've never seen a utility in a city that calls themselves a city that doesn't have on their webpage how much we're gonna expand this year. You open up Homer's page, they're gonna tell you how much line they're putting in this year. We call ourselves a city, we have public works, we got people. If you don't have competent people to put in this, I don't think that's the issue. I think that our city should be asking more of our public works to be expanding this water and sewer infrastructure. I think it's simply a not asking or demanding piece to public works.
I don't think Doug would argue with you on any of this.
I would totally agree with you, and as a matter of fact, the city of Seward is working on updating their comprehensive plan as today. And they'll be moving forward with a new comprehensive plan, and in those plans, those ideas should be, put in, the community feels that there should be a periodic, regular expansion in these areas. It'd be appropriate to get that information to council or to one of the boards that council, planning and zoning is very active.
I mean, it's one of the reasons our electric utility kind of fell behind, because the city just, the prior utility managers had it on their wish list to do these things, and had we been doing them over the last 10 years, instead of trying to do everything all at once, we wouldn't be in this rate shock.
But it was also a cash cow, right? Is that $2 million a year average, or is that just a big snapshot of your?
From what I understand, it's been going on forever.
That's low.
So it's just a cash cow as far as the budgeted people were concerned.
So when in their sale,
Can I weigh in as a
Daryl.
long time and have substantial experience in the history of this?
Yep.
As an enterprise fund, they're designed in part to provide a service, which they do. The city has several enterprise funds, for example, electric is not the only one, to help keep down the cost of taxes for the corporate residents that own the community.
60% of the houses that are
And
owned
so
by people.
those payment in lieu of taxes do just exactly that. That $2 million that you're talking about, that the electric fund contributes to the general fund of the city, helps keep down property taxes. And perhaps
Not
sales tax.
not
Well,
for
I
me.
understand that, but you gotta recognize, the corporation is within the city of Seward. It doesn't extend outside its corporate limits. It can by state law.
If it was a cooperative, could it?
Well,
Yes.
Let's do it.
well, it could, but
totally
then
agree.
but then, as you guys live inside the city, those losses of revenue that go to the general fund by doing that, unless property taxes charged and collected, charged to the cooperative that would then own the utility, if they don't equal what the city is getting, you're gonna have to make up with those monies. And that was part of the dynamic selling to Homer Electric. The Homer Electric proposal didn't cover all of the city's costs that they would have to meet otherwise to the general fund. And you gotta think about what that's gonna do to the corporate residents of the city, the voters who live inside the city limits. That's where the city council has to focus. That's who they represent. They don't represent
Me.
Unfortunately, Kevin chose to live outside the city.
Yep, that's right, I decided.
His representative lives over in Soledad, he's called Peter Machicki, he's the borough mayor. And the assembly members, of which Cindy is one of them. Now, that's just a little explanation of the realities of government here. But if city has to give up that $2 million that goes to the general fund, that's gonna have to be made up somewhere else. They're either gonna have to increase sales tax or property tax. They have no other avenues to make that money. So that's one of the challenges that are in front of the city fathers here.
So instead of you selling the utility, why don't you just stop sucking money out of the utility and pay the people in the utility? And, I mean, it just beggars the imagination. So, say you sell a utility for $17 million, how many years is that before you've run through that $2 million a year? It's what, 8 years? 8 years, 8, 9 years. And then
you're
plus
raising taxes.
Plus you've got that lump sum
Right.
payment coming in, so you're gonna go spend that on something.
Well, plus we have the Port of Tobago coming in, so we're gonna increase our electric.
Just on that, handing the state a lump sum, be pretty dangerous and heavy, because there's.
Well, unless they say build a city hall with it.
But I question, you brought up that within a year that vote couldn't happen again, is that correct?
There could, in one more year, the vote's tomorrow, is it? Or coming up, or next week?
Municipal elections.
Yeah, so, in 1 year from that time, I think it's, in the city charter that they can have another, if they would like to, another try at trying to sell them utility.
Cause it just seems to me, I mean, what I know personally angered me was turning around, having a second vote, and moving the goalpost.
Yeah.
And then you lost, and it seems like, okay, we're in a holding pattern, and so, I mean, is it reasonable to assume, feeling that we're in a holding pattern until the smoke comes up again, or?
That's up to the council.
Right.
That's their decision if they wanna bring it back again.
Well,
But it would be the citizens that would ask for them
It's
to bring
also
it
gonna
back
be
again.
up to the council,
What's that?
it's also gonna be up to the council how many of those meetings are had in private without any of our say being had in them.
They pledged to do it publicly.
And you believe them?
Yeah, I believe them, why not? Look at her to believe them.
I mean, is there movement to find alternative, solutions to, this other than selling to Homer Electric?
I mean, personally,
Judy
had they decided to take when the bids came in, Chugach was lower,